Okay, so moving on to the second question in this section C. So evaluate the factors that might influence the supply of labour in an occupation of your choice. Again, Edexcel are almost screwing you if you don't know any real world application. So like I always say, it's of utmost importance for you to know industries, you to know examples of basically everything. So you need to have a really good depth of real world application. Let's see what the stimulus is talking about. UK facing large labour shortages, hard to fill vacancies like software engineers, construction workers and nurses. Now this is an example I usually teach in my live classes since there's so much depth in it with regards to labour markets, and this is a really good example that I would learn, and we'll go through a bit of this as well. But now, just as a general tip, of course this is for revision, so I would 100% attempt this question, but in your exam or if you're doing any mocks, I would never pick a labour markets question, since let's look at the two choices we have here. We have an absolute... Now of course this is for practice, and I would always suggest practice all questions. Do not neglect any question since you don't know what's coming up in your exam. But now, since you have a choice, and if this was your real exam or your mock, you have an absolute gem of a question. One that is going to be very easy for you to write as much chain of analysis. You can write loads, really good evaluation. And then you have a labour markets question. Yes, labour markets question, it is a decent question, but are you, as a student, what are you more confident with? Where do you feel like you can write more chains of analysis, more in-depth, more evaluation? 9 out of 10 times I would be picking this, but 100%, that does not mean neglect practicing labour markets, but I would just spend a bit more time on the monopolies, on the market structures, on the market failures, since if a question does pop up on them, you should be picking them, since that is where, if you've done more work on it, and it's more, as if you've done more work on it, you should score better. And since these are the more popular questions, they come up more, these are the ones that should be prioritising practicing more. What factors influence the supply of labour in an occupation of your choice? And of course, like I said, we're going to pick nursing in the UK. But the main factor, and the first one that should come to your mind, is the most obvious one, but a lot of students do forget it, is of course the relative wages. Okay, we're going to go more into depth with wages later on, but I want to paint the picture so it'll all come together in one. So one of the factors that influences supply of labour is definitely wages. And with nursing, another factor that affects supply of labour is definitely skills. So with nursing, for example, you usually have to do like 3 years of degree level or just a degree to get into nursing. You have to register with the equivalent of the GMC, so that you have to register with an official body. It's a regulated body to become a qualified nurse. So this, like I said, 3+ years of training. Now, let's think how that affects the supply of labour. So if the wages of nurses went up massively, would the supply of nurses go up massively? No. So what does that mean? That means the supply of labour is not responsive to a change in price. Thus, that suggests inelastic supply of labour. And why is that? Since it takes 3+ years for nurses to train. So therefore, if the wages of nurses went up, there wouldn't magically be hundreds of thousands of new nurses appear randomly, as it would take time for these nurses to train. It would take time for these nurses to be that time lag between the wages increasing and new nurses being trained would mean that, therefore, in the short run at least, there is inelastic supply of labour. And how would we show that? Of course, on a labour diagram, we have wage on the y-axis, and then we have quantity of labour on the x-axis. And the inelastic supply of labour would, of course, look something like this, just like an inelastic demand or an inelastic supply curve. It's just steep. So we've talked about the inelastic nature of nurses' supply. Now let's investigate further, and let's think about their demand. Whenever you think about elasticity in labour markets, always think about how they would respond to a change in wages. So let's give the example that nurses' wages increase. So how would that affect the elasticity of demand for nurses? And remember, in labour markets, firms are doing the demanding and workers, us households, are doing the supplying. So if nurses' wages increased, what would be the elasticity of demand for nurses? So we expect, if there's elastic demand for nurses, we would expect an increase in wages will lead to a significant or a proportional decrease in the demand for nurses. However, in reality, will this happen? No, it can't happen. Why? Because nurses are an essential service. If the NHS don't have nurses, its hospitals, the NHS itself cannot operate. And there are very few substitutes for nurses themselves, as the NHS can't just hire untrained workers to fill that role. Therefore, that would suggest if wages did increase, the NHS would not be very responsive, especially in the short run, to a change in wages. Thus meaning, so if there's inelastic demand and inelastic supply, what does this therefore mean? It leads to a high equilibrium, well, a relatively high equilibrium wage for nurses. But now, in the real world, does that hold true? Does it hold true? Would you say nursing is a high-paying job? If you've ever read the news, if you know anything about nursing, that is very untrue, and it's quite opposite, that nurses are definitely underpaid and things like overworked. But why is that? So if they have inelastic supply of labour and inelastic demand of labour, economic theory would suggest they would lead to a high equilibrium wage. But then why are their wages so low? And this is the exact concept of monopsonies, and more specifically, the NHS's monopsony power. So, of course, what does a monopsony mean? Is when there's one dominant buyer of labour in the market, and this, in the UK, of course, is the NHS. And with Edexcel, you do not need to, it does not explicitly state on the spec that you need to know the monopsony diagram, but it totally depends when you're watching this video, I would say. If you're watching this video 2-3 days before your exam, which I know a lot of you will, do not learn the monopsony diagram. It's not that high yield that you need to learn it. You should focus more on just overall everything. If you're watching this well in advance, maybe a couple of weeks, maybe even a couple of months before your exams, 100% I would suggest learning the monopsony diagram. It's not on your spec, but it still adds a lot of depth to your essay, and you can be credited if you use it well. So, and a lot of times either students will learn it and they think it's definitely on the spec. If you're like cramming and you need to prioritize what to learn, the monopsony diagram is not on your spec. If you just make sure you know the theory behind it, you do not need to know you don't need to exactly know the diagram. But if you have that buffer, if you've been putting the work in throughout the year, 100% monopsony diagram is a good one to know. Anyway, I'm getting a bit off topic here. This is not ultimately very related to the question. So the way I would do it, by the way, with this question, I'm just trying to explain the case study to you, since of course lots of labour markets questions will be worded differently, and that is a very, very good case study and a very good thing to know. But for my first paragraph, I would do wages, and then just talk about how in the nursing industry there are low relative wages, and then just mention how the low relative wages, the low equilibrium wages, affect the supply of labour. Of course, with low wages, it's all to do with incentives to work. If there's low wages, there's low incentive to work, thus meaning that nurses will supply less labour, meaning that there's like a shortage of labour in the nursing market. And that's how I'd word the paragraph. I probably would not mention the monopsony power. That is just more to do with that case study. And then for my second paragraph, I would have mentioned the high relative skills in nursing, as it takes 3+ years of training. Talk about how this leads to inelastic supply of labour. I probably wouldn't actually even mention demand, because again, it's nothing really to do with this question. Just talk about how why, like what I explained before, why there is inelastic supply of labour, as if wages increased due to the extensive years of training required, there would not be a proportional response to an increase in wage. So there would not be a proportional response of supply of labour to an increase in wages, thus suggesting inelastic supply of labour, of course, meaning inelastic supply of labour, basically. And for this question, since your paragraphs are probably not going to be too much in depth, since there's not actually that much to speak about, I would do a third paragraph, which would be on non-pecuniary benefits. These are things like non-monetary benefits, like job satisfaction, which of course in nursing, since you're helping humans, is quite high, but then the pressures of the job do wear that down. So you can mention that things like working conditions, the very poor working conditions would, of course, not sort of benefit. It's a negative, isn't it? It would definitely reduce the supply of labour. Career progression, social status, all those things would come under non-pecuniary benefits. Write a paragraph on that and talk about why that would lead to, how that would affect the supply of labour. And then of course I would relate it to nursing, and most of those are going to be very bad for nursing, since the NHS is not the best with the working conditions of nurses. But yeah, and that's pretty much how I'd answer that 25-mark question. Now, one thing students really struggle with labour markets is evaluation. So I'm going to run through a few evaluation points just generally. So for example, if these two paragraphs are quite big, they're quite chunky, you've got a decent chain of analysis, you can actually use non-pecuniary benefits as a evaluation. So if you're saying something like low wages is going to lead to a low supply of labour in the nursing market, you can then say, however, in evaluation, this depends on the non-pecuniary benefits, as the job satisfaction is very high for nurses, since they are helping individuals. Obviously, you just neglect a bit of information. It's very high for nurses, as they're helping individuals, thus meaning that the non-pecuniary benefits may outweigh the low wages. And one I mention everywhere is always time frame. So in the short run, there might be a lack of supply of labour, but then it depends on government policies. It depends if the government increase things like apprenticeships, bursaries, like training schemes, that could massively increase the supply of labour, and it's a factor that affects the supply of labour. And a big thing specifically with nurses, another valuation point, is definitely migration. There's a massive percentage of nurses that used to come into the UK from Europe. So post-Brexit, that has obviously been massively affected since the laws and the regulations with workers moving between Europe and the UK have changed massively. So post-Brexit, there's been a massive undersupply of nurses from Europe, which is one of the main reasons why the UK NHS is struggling with the undersupply of nurses. So you could say, how in evaluation, this depends on the levels of migration, or again, depends on levels of government policy, as if they alleviate the policies, maybe reduce the regulation or alleviate the constraints for nurses moving between Europe and the UK, it could again improve the supply of labour. And then of course conclude that all with the final judgment. Anything you haven't used in your plan, use it in the final judgment. But yeah, that is a wrap on Edexcel Paper 1 2022. On to the next paper.